Welcome. Today, we're delving into the complexities of mucopolysaccharidoses, a group of inherited metabolic disorders that significantly impact the nervous system and overall health. Specifically, we'll be exploring conditions like Hurler syndrome, shedding light on their causes, effects, and management. Mucopolysaccharidoses, or MPS, are caused by genetic mutations. These mutations disrupt the body's ability to produce specific enzymes, or cause them to be defective. These enzymes are crucial for breaking down complex sugar molecules called glycosaminoglycans, formerly known as mucopolysaccharides. The specific gene affected determines the type of MPS a person will have. These genes are passed down from parents to their children. If both parents carry the faulty gene, there's a risk the child will inherit MPS. The lack or malfunction of these critical enzymes leads to a buildup of glycosaminoglycans within cells, lysosomes, and connective tissues throughout the body. This accumulation disrupts normal cellular function and causes progressive damage to various organs and systems. In the nervous system, this buildup affects brain development, neuronal function, and can lead to cognitive decline, hydrocephalus, and other neurological problems. The skeletal system, heart, and other organs are also severely affected, as the glycosaminoglycans infiltrate tissues leading to inflammation and cellular damage. MPS disorders are relatively rare. The overall incidence is estimated to be around 1 in 25,000 live births. However, the prevalence of each specific type varies considerably. Hurler syndrome, or MPSI, is one of the more common forms but still rare. These disorders affect individuals of all ethnicities, though some types might have slightly higher prevalence in specific populations due to founder effects and genetic drift. The signs and symptoms of MPS disorder are diverse and often progressive. In Hurler syndrome, these can include skeletal abnormalities like dysostosis multiplex, characterized by unusual bone shapes and joint stiffness. Individuals often have coarse facial features, a large head, macrocephaly, and a protruding tongue. Clouding of the cornea can impair vision. Developmental delays, intellectual disability, and hearing loss are also common. Heart problems, respiratory difficulties, and hepatosplenomegaly, an enlarged liver and spleen, are other frequently observed issues. Importantly, the severity and onset of symptoms can vary among different types and even within the same type of MPS. Diagnosis usually involves a combination of clinical evaluation and laboratory testing. Doctors will look for characteristic physical signs and symptoms. Urine tests can detect elevated levels of glycosaminoglycans, suggesting an MPS disorder. Enzyme assays, performed on blood or cultured skin cells, measure the activity of the specific enzymes involved in breaking down glycosaminoglycans. Genetic testing can confirm the diagnosis by identifying the specific gene mutation responsible for the condition. Prenatal diagnosis is also possible through amniocentesis or chorionic villus sampling. MPS disorders are classified into different types based on the specific enzyme deficiency. For example, MPSI encompasses Hurler syndrome, the most severe form, She syndrome, the mildest form, and Hurler, She syndrome, an intermediate form. MPS-TI is also known as Hunter syndrome. Other types include MPS-II Sanfilippo syndrome, MPS-IV Morpio syndrome, MSV-Azamorote-Lamy syndrome, MPS-VIT-Sly syndrome, and MPX-Natoix syndrome. Each type is associated with a different enzyme deficiency and, consequently, different clinical manifestations. Currently, there's no cure for MPS disorders. Treatment focuses on managing symptoms and improving the patient's quality of life. Enzyme replacement therapy (ERT) is available for some types of MPS, providing the missing enzyme to help break down glycosaminoglycans. Hematopoietic stem cell transplantation (HSCT), also known as bone marrow transplant, can also be an option, particularly in the early stages of the disease. Other supportive therapies include physical therapy, occupational therapy, speech therapy, pain management, and surgical interventions to address specific problems like joint deformities, hernias, or carpal tunnel syndrome. Gene therapy is also being investigated as a potential future treatment option. As MPS disorders are caused by genetic mutations, there is no definitive way to prevent them from occurring in the first place. However, genetic counseling and carrier screening are essential for families with a history of MPS. Carrier screening can identify individuals who carry the faulty gene but don't exhibit symptoms. This information allows couples to make informed decisions about family planning and consider options like preimplantation genetic diagnosis, CPGD, during in vitro fertilization. The prognosis for individuals with MPS disorders varies widely depending on the specific type and the severity of the condition. In severe forms like Hurler syndrome, life expectancy can be significantly shortened, often into childhood or early adolescence, if left untreated. ERT and HSCT can improve the prognosis, but these treatments are not always effective in preventing all complications. Recent research is focusing on developing more effective enzyme replacement therapies. gene therapy approaches, and strategies to deliver treatments directly to the brain to address neurological complications. Clinical trials are ongoing to evaluate the safety and efficacy of these novel therapies, offering hope for improved outcomes in the future.